Hello, this is Melissa Cole, and you're listening to an Oshawa Museum podcast. This podcast series aims to actively promote awareness and appreciation of our community's history, highlighting remarkable artifacts, documents, photographs, or events from our past. We hope you enjoy the podcast. Just over 100 years ago, the province of Ontario, including the town of Oshawa, experienced a public health crisis that resembles today's COVID-19. From 1918 to 1920, the Spanish influenza swept the world and killed 50 million people worldwide, taking the lives of young and otherwise healthy adults. This flu had little to do with Spain, but was named so because that is the country where it was first widely reported. It originated from China, similar to COVID-19. It started in February, and the First World War had just taken place, which created the ideal environment for the flu to infect, multiply, and spread rapidly across the globe. It reached the United States in March 1918, and it reached Canada through troop, hospital, and civilian ships sailing from England to Grosse Island. Montreal and Halifax were the main routes of infection into Canada. By late July, it had spread across the country via the railway. According to public health authorities, quote, the failure to restrict train travel early on was one of the terrible oversights. 50,000 died in Canada, accelerated by complications from infections such as pneumonia. In Ontario, 300,000 cases and 8,705 deaths were recorded. But these figures likely don't tell the whole story. Medical systems were overwhelmed, meaning that many fatalities almost certainly went unreported. This is evident in the reports that were sent in from local medical officers of health. The largest percentage of death in Ontario from the Spanish flu occurred in York County, where 17.3% of the population died. York contained Toronto, the largest city at the time in Ontario. Carleton County, which included Ottawa, accounted for 5.8% of the deaths. And Wentworth, that included Hamilton, had 5.1% of the deaths. No other individual county had more than 5% of the total deaths. Between 1918 and 1919, Oshawa had a population of approximately 10,000, and there were just over 300 deaths recorded. 84 of those deaths were infants under 1 year of age. Just like today, we tend to think of the young and the elderly as being most at risk, but most of those who died during the Spanish flu epidemic were between the ages of 20 and 40, the same demographic already decimated by the First World War. In Canada, the provinces of Quebec and Alberta were the most severely affected, which is one of the reasons that archives such as Glenbow Archives in Alberta have such a wealth of information related to public health and the Spanish flu. Let's take a look at Oshawa's first public health system and the various diseases and pandemics that have affected our community since the 1870s, when Oshawa first became a town with a population of only 3,800 people. An article in the Oshawa Vindicator from April 19, 1871 states, the two great causes of fever in this place are dirty yards and dirty cellars. The northwest corner of King and Simcoe Streets may be termed, quote, the fever corner of the town, unquote, as more cases arose in this location than any other in the area. The area does not drain, stagnant green water lies in pools along the ground. The owners of the property should take responsible steps to ensure that their property is properly drained and that proper drains have been dug. Because of decaying vegetables that are allowed to accumulate, this may account for the disease in many households. Any man who values his family should attend to this matter at once. In the end, it would be found much cheaper to pay the drain digger than the doctor, this article states. Let's take a look at this 1884 fire insurance map from our collection here in the archives and look at the area that's discussed in this article. A report from 1901, the local board of health, was forwarded to the provincial authorities, and it shows that there were no cases of typhoid that year. Although the report discusses the sources of typhoid was originally from wells in which water was extracted by means of pumps. The report indicates the care taken to dispose of the waste material from slaughterhouses. The document reports that it was fed to swine. On this map, it shows the sources of water tanks and why it was so important to dispose of waste properly. Oshawa's first Board of Health was started in 1884 when bylaw number 285 was passed by the Town Council to establish a Board of Health. The first recommendation from the Board of Health was the passage of a bylaw making the inspection of the town's milk supply compulsory for all dairies that supply milk to the town, that they must obtain a license and their premises must be inspected. They also instituted a cleanup week in 1890, asking citizens to clean up their backyards. In 1903, the board purchased a formaldehyde generator to use by doctors in disinfecting homes where infectious diseases had been treated. In 1904, Oshawa received its first pumping station and municipal water supply. The following year, outbreaks of smallpox, scarlet fever, and diphtheria had occurred in the town. But hopefully, the cases were less severe because of some of these implementations by the Board of Health. Patients at the time would be isolated either in their homes, and there has been mention of a home that was on Park Road South being used to isolate patients. This outbreak further pushed the need for a hospital in our town. The Provincial Board of Health reports in 1905 states that Oshawa was one of the towns to take it upon themselves to form a waterworks. This allows for sanitary water supply and proper disposal of the sewage and filth, so the mortality will largely decrease. A few years later, in 1907, Dr. Mackay was hired as the first medical officer of health. 2 years later, the board recommended the installation of sewers on certain streets. Again, hopefully decreasing the mortality rates in the future. This political cartoon from the early 20th century illustrates how public health programs intersect with the values and structures of society and could be controversial at the time. These cartoons tell the stories of public health initiatives and some of the challenges that were faced. This cartoon comments on the attempts of Toronto's medical officer of health from 1910 to 1929, Charles Hastings, to make Toronto cleaner and healthier. During the late summer of 1919, a number of smallpox cases were reported in Toronto. There had been little reaction until, at the Provincial Board of Health meeting, it was revealed that 4 cases had been discovered in Oshawa, and 1 each in Harmony and Cedardale, which at the time were both part of East Whitby. Precautions were taken to secure the buildings in Alexandra Park as an isolation hospital, and nurses were lined up to look after people suffering from the disease there. Homes where residents with the disease lived were quarantined, and these homes were patrolled to ensure that no one left or entered these homes. Visiting at the Oshawa General Hospital had been banned. Health inspectors Fred Palmer and Dr. Mackay worked night and day to keep the disease under control. Vaccination at the time was not mandatory, although it was advised that all students in school be vaccinated. After 4 high school students contracted smallpox, it became mandatory, and if a student was not vaccinated, they would be expelled. The Reformer newspaper reported that doctors were busy with vaccinations and sore arms. It's reported that a number of young women were reported to have protected their beauty by being vaccinated on the ankle. In 1918, the Spanish flu swept through the maternity hospital located at Llewellyn Hall. This home was donated to the Oshawa Hospital by R.S. McLaughlin and Adelaide McLaughlin. It was reported that 95% of the babies in the ward passed away. Unfortunately, these numbers were not accounted for or submitted to the Provincial Board of Health as a direct relation to the Spanish flu. But this may have been the reason why 53 infants under the age of 1 died that year. The following year, in 1919, it was reported by Dr. Mackay, the medical officer of health for Oshawa, that the town was not greatly affected by the Spanish flu in 1918, which is indicated by the decrease in deaths attributed to, quote, the freedom of the town from the Spanish flu epidemic, unquote. Although when the Spanish flu epidemic hit Oshawa, beds had been placed in the armories to treat the sick, and all churches and schools were closed to prevent it from spreading. Just like today, everyone was encouraged to stay home. Unfortunately, on November 11, 1918, though, it was impossible to convince Ontarians to stay home. Despite continued concerns about public gatherings and pleas from politicians to wait until December, people all over the province took to the streets to celebrate the Allied victory and the end of the war, the First World War. Here is an image from our own community celebrating in the streets of Oshawa during the Armistice Parade that took place on November 11, 1918. Look at those crowds. Let's take a lesson from history, and please stay home. This has been an Oshawa Museum podcast. Thank you for listening. If you enjoyed this video, be sure to check out our other historical video podcasts and subscribe to our channel. Stay well and stay safe.